couple of tidbits to keep in mind as I bring Anita up here for the demonstration. First of all, what you are seeing is out of context. I would not be pulling a client in the first time and say, all right, what is it we're going to work on? And jump into this level of work. I screened Anita yesterday. She has experience with EMDR as a client, so she knows a little bit about the process where I'm not starting from step 0 with her. She also has reviewed some of her resources with me. So she's done a lot with breath, with visualization. So I know she has those if she for some reason wants to stop and we need to go to them. With clients, I would often need to spend several sessions, if not several weeks to months, building those, particularly if they come in with nothing. So I never bring anybody up here for a demonstration who is not already well resourced. So we are going to jump in pretty quickly into this. You'll see me do some attuning breath with Anita, and then we'll go into the issue, the target that she wants to work on. And even part of EMDR therapy, there's a whole procedure in place for taking a history around presenting issue. And just know that I did a lot of that with her yesterday so that we can save the time up here today. And the other thing is Anita is a little bit on the soft-spoken side. So what I'm going to do is if I feel something she has said is a little quiet, I may repeat it just for your benefit. Know, though, that that's generally not a part of EMDR. Typically, I'm not doing that much repeating and paraphrasing, but if you hear me do that, it's because I'm afraid what she says may not be heard by all of you. All right, so how do you feel initially being up here? What's your kind of first gut level reaction?
I'm ignoring it.
You're ignoring it all? Okay. Do you feel we need to set up any kind of visualization or energetic shield kind of burying them from us?
No, because I'm partially sighted in that eye. So I can.
You can block them out anyway.
Yeah, I can block them.
Brilliant. Okay. So let's start by doing a couple attuning breaths. What I like to do here is just have me show you how you breathe. You can keep your eyes closed or open, and as I notice the way you breathe, I will join in with you. What are you noticing now?
I'm feeling better balanced. Feeling more here.
Good. Let's do another set, just having you breathe with that idea. Feeling better balanced, feeling more here. I'm going to do a test set of tapping while I have you notice that. Just slow tapping. Breath. Release. So for the tapping, side of the leg, top of the leg, or your hands? Okay. So let's test the faster speed before we do anything. Too fast, or no? Can you tolerate faster if I need?
Tolerate faster and firmer.
You can tolerate faster and firmer. Okay.
Because I think it works better for me.
Okay. Is this too much? Nope. Nope. All right. May go a little bit more than that, but probably not much firmer. Okay. All right, and this is your stop sign. if you need to stop at any time, and we'll come back to one of your other resources. All right, so as you know with EMDR, you can give me as much or as little detail as you want as I ask you these questions, and usually the less detail, the better. So do you want to begin by telling me about the presenting issue, or going right into the thing you want to target?
The presenting issue is that I have to have an MRI scan, which includes having a line put into my arm so that they can inject a dye.
Yeah. And that's happening soon, right?
Yeah, that's happening on the 20th of May.
Okay. And as you told me when we screened, you struggle with medical procedures.
Yeah.
And what does that float back to? What is the target that we need to work on related to the medical hesitance?
The target was that as a child from 8 to 10, I spent 2 years in bed in horrendous pain. I couldn't walk. And I had to have a series of blood tests. And in one of these, the doctor was not very experienced. He was a young doctor. And he ended up smacking me because he couldn't get the blood out of me. And it's made me, I get very angry around medical procedures, and I think my child is quite frightened. My small child is quite frightened. But there's an incompetence about putting the line in my arm. So I won't let people try more than twice. So if they've tried twice and they can't get it in, I say no. I'll have to have a scan, and the doctor can put it in under a scan.
So as you know, with EMDR, the older back we can go, typically the better. So are you okay jumping into this childhood memory?
No problem.
Okay. So if we're using that as the target, is there an image that represents the worst part, or some other feature of it that represents the worst part of it for you right now, looking back?
Looking back now, it's been in a room with a doctor in a white coat. There's the nurse there, and my mother is there as well. And there's blood. There's quite a lot of blood because he dropped one of the vials. And my mother can't bear it any longer, and she walks out. And what he does then, he smacks me hard and tells me to behave myself. And the nurse, I have a feeling that the nurse freezes. She doesn't know what to do at that stage. But in the end, he has to get somebody else to come in and do it.
So right now, looking back on this worst part, is there a negative belief about yourself that goes along with it? As you know, usually an I am or an I am not statement.
For me, one of the injunctions, one of the big injunctions is, I am not ever going to be ill again.
Okay.
Because this is how I will protect myself.
So what would you like to believe instead?
I'm going to be ill. No.
I know, that sounds a bit weird, but I can see where the shift, or it's okay to be ill or something like that.
Yeah, it's I mean, obviously, I'm having this is the 5th anniversary of me having cancer. Yeah. So it's a 5th follow-up MRI. So it's an important one because it's like a transitional thing. So I have managed not to be ill, but then I've got cancer.
Yeah. So again, considering all of this, how would you phrase that as a positive belief or a preferred belief you would like to embrace?
It's okay for me to, it's okay for me to go to the doctors.
Okay. So, as you know,
Or doctors don't abuse.
So I try to steer more towards personal language because we can't really control what they're going to do.
Yeah.
So that would work for me right now. It's okay for me to go to the doctor. How true does that feel in this moment? Now,
Not true at all.
Not true at all. So 1 to 7, if 1 is completely false, 7 is completely true.
So if 7 is completely false.
No. One is completely false. 7 is completely true.
I think it's about 2,
Okay.
1 or 2.
Okay. And what emotions are coming up for you right now, looking back on that
anxious.
image or worst part?
I'm anxious.
Okay. So distress level, this is the other scale,
Yeah.
0 to 10. If 0 is nothing or neutral, 10 is the worst you can imagine.
I think it's about 8 or 9, but I've got a feeling it might be 11.
Okay,
Fair
fair enough. And what are you noticing in your body right now?
I'm noticing I can feel it here, and I can feel it around my solar plexus as well.
All right. Let's get rolling. So notice that body sensation you just described.
And I start to feel really angry, is the other thing.
Good, notice it. So bring it all up together with your image or worst part that you described for me, being in the room. Doctor, white coat, nurse, mother, a lot of blood everywhere. And he tells you to behave. Nurse freezes and smacks you. No. So put all of that together with the body sensation and the negative belief, I am not ever going to be ill again. See what you notice. Breath. What are you noticing now?
The veins in my arms are humming, and they feel like they're shrinking and running away from him.
Go with that.
Nasty man.
Go with that.
Nasty, incompetent man.
Go with that.
And that's just walked out of the room.
Take a breath. Go with that.
Now that you're frightened of the nasty man.
She said, I'm now very frightened of the nasty man. What are you getting, Anita?
I'm guessing that when my mother was there, I felt kind of cheeky and kind of okay. And then when she couldn't bear it and walked out, part of me collapsed, because if she couldn't bear it, then it must be horrible.
Go with that.
So. actually, this isn't about him, this is about the fact that the hospital allows somebody who's just qualified to be outside his competence. Yeah, I feel, yeah, and I don't know if I'm rationalising it, but that's what's suddenly come into my mind.
Go with it.
He still shouldn't have hit me.
Go with that.
Bastard.
Go with that.
Can I kick him?
Go with it.
Thank you.
If you need to physically do it, just don't kick me.
I'm not.
But if you can visualize it, go with it.
I'm gonna kick him.
All right.
Yeah, and I'm gonna run out the room, and I'm not going back. Yes, I've done it.
You've done it?
Yeah.
Keep going.
So I've gone up to my mum, and I'm really, really angry with her as well.
Okay, go with that.
However hard that was, you should have stayed in there with me. I'm a child. I needed you. She has a good reaction to that. She really does.
Go with that.
She promises me that she'll never do that again. And she never did do it again. She always stayed.
Go with that.
And she made them come to the house in the future. So she made a consultant come to the house to take the blood, so I didn't have to be in a hospital setting again.
Go with that.
So I don't feel as helpless or out of control. Well, she did do that, I forgot. She made them come to the hospital. Oh, sorry, come to the house. And it was a long way, it was about 10 miles. And we did. And she wouldn't tell me that they were coming, so I didn't have a long time to worry about it. Yeah, so it was over very quickly.
Go with that.
See my dad carrying me out to one of the armchairs because I couldn't walk, and the doctor. He flirted with that doctor.
Yeah.
It was a lady who came once and he flirted with her. And I was so angry with him.
Go with that.
This was my doctor, this was my arm, this was my blood. And he's being cheeky with doctor. Nasty daddy. He thinks I'm funny.
You think you're funny?
In a nice way, it's okay.
Take a breath. So let's check in. Take another breath. Kind of at a pause. When you bring up the original target image where we began, in this moment, where would you rate the distress level if 0 is no disturbance or neutral and 10 is the worst you can imagine?
I think it's really very, very low. I would say about, I don't know if it's 0 or 1, it's very low. After I kicked him, and ran out, I felt more powerful, so I didn't feel quite so, I just felt that it was all within my control again.
So go with that. It's low. Maybe be attuned to, is there anything keeping it from being a 0?
Right. What came into my head immediately is my mother went out. So that was a later part of the original memory. So I think what shocked me, the additional shock, was the way that I crumbled when my mother walked out. That up until then. So what part of it was me? Was I that confident, or was I only that confident with her there? And how frightened I was that she was upset.
Go with all of that.
My heart feels smooth.
Go with that.
I think as a mother, now looking back, I would be equally distressed. Oh yeah, and I remember, I'm furious.
Yeah?
Everybody told me how lucky I was. Because children who got this illness quite often had really bad, it used to eat the valves for heart. And it's been caught so early, my heart was fine. So people used to tell me how lucky I was. They wouldn't give me painkillers in those days because they said children didn't feel pain. So I was in excruciating agony, and people were telling me I was lucky. I couldn't walk. Bloody hell.
Go with that.
Oh, that's where the some of the anger is. Aren't you lucky? Aren't you lucky it didn't affect your heart? Look at these poor children here. They've all got bad hearts. You haven't. What a lucky little girl. Polite little girl. Okay, can I tell them all to fuck off?
Go with it. Go with it.
Fuck off, all of you. You've got no idea of the pain I'm in. Just fuck off with your lucky. Oh,
what are you getting at?
My mother's horrified. They've never swore in front of me, apart from in Russian. And, the fact that I...
Yeah? Keep going.
Oh, dear. Bless her. There's a lot of very sour faces. I just feel that I've got it out. It's lucky. Oh, I've forgotten about that. Makes me aware that in trying to make people's experience better, look at the positivity, the things that we say sometimes are just not helpful.
Yeah. Yes. Point well taken. Let's check back in with target. Where you bring up the original target image. In this moment, 0 to 10.
0.
To 0?
Yeah. I've forgotten that aspect of it.
Good? Good. All right. So more importantly, let's go to the positive cognition. Does the original positive cognition, it's okay for me to go to the doctor, still fit? Or is there another positive belief that has come up that feels like it's a better fit?
There's another different memory that impacts on the memory about going to the doctors being okay. And it's not part of this at all, but it does impact on this.
Does it feel like something you don't want to go with today and contain? Or is it something you think you can go with in a few minutes' time?
I'm aware of the time thing that we've got here. And I don't know if it will. I don't know if it will take a lot of time because I did resolve it.
Okay. If you've resolved it at some other point with another kind of process, I would say let's go with it.
I resolved it with the doctor.
Ah, got it.
So I confronted him about it and said I wasn't going to come back and see him again when I was, I think, about 15 or 16.
It's up to you. Do you want to go with it?
Okay.
You don't have to tell me detail. You know that.
But that, I think, has been one of the contributory factors about why I won't go and see my GP. Who's a nice man. Oh, I feel sad.
Yeah. Go with sad.
I feel sad because this has stopped me going to the doctors all my life, and this was never about me.
What are you getting now?
I'm guessing that I went and changed my doctor, and the new doctor wanted to know why I was changing because I was quite young to be doing that, and I told him, and he wasn't surprised. He wasn't shocked and he wasn't surprised.
Yeah.
So
Go with whatever's there.
And you know, he was always a really good doctor for me. I feel sad that I didn't let the positive experience of him flood me more.
It's okay for me to go to the doctor. Is that still a good positive belief, or is there
Yeah.
another? Okay.
No, it's okay for me to go. Yeah.
So would you rate it 1 to 7? 1 is completely false, 7 is completely true. It's okay for me to go to the doctor.
I'd say about 6, 7.
Okay,
Yeah.
6, 7.
Yeah.
So notice just maybe if there's a little bit lingering there.
I'm always going to be suspicious. It's part of my nature.
Go with that. But if it's part of the nature, that could be organic here.
Yeah.
So now here I'm really going to challenge you. It's okay for me to go to the doctor. It's a good positive belief. Can you make that into an I statement? Like I can go to the doctor, or some other wording of that with an I statement.
Yeah. I can go to the doctor.
So let's work with that. I can go to the doctor. In this moment, 1 is completely false, 7 is completely true. Especially as you look back on the original image.
Yeah.
How true would you rate that?
No, I would say that's true.
Okay. So let's hold that true belief, that positive belief of I can go to the doctor, together with that original target image. Notice what you notice.
But not that dot.
Right.
Oh dear, that was really young.
Take a breath. So now I'd like you to scan your body head to toe. So start at the top of your head down to your feet. And tell me what you're noticing in this body scan.
No, it's clear.
It's clear.
Yeah.
Okay, so hold that clear body scan together with I can go to the doctor and the original target memory. You game for a little future template here? Future template, future scenario?
Yeah.
Right, so now I'd like you to imagine, it's a couple weeks from now, you're going to, let's see what I
On the
noted.
20th
On the 20th,
of May, I've got an
the
appointment.
MRI scan.
Yeah, and I've got an appointment with my consultant at the same time.
Got it. So right now, as you bring that up, what are you noticing?
I really like him. He's a really nice man. There's a bit about this future, having this line put in my arm.
Yeah.
There's a bit about that because there's something about having the tests done. This is the 5-year thing.
Yeah.
And what it does is every time I have the tests done, it reminds me of the original cancer. And I don't want to be stuck in ex-cancer patient. I want to, it's like, I hate the word survivor. I think it's a step on a road to somewhere.
Yeah.
And I think that was a step on a road to somewhere. I don't want to kind of keep talking about that this is what I've had and this is what I've been through. I want to have it behind me. But every time I go for a checkup, it reminds me again, and it throws me back into it, and that annoys the hell out of me.
Go with that. Good.
There's this bloody injunction about I'm not going to be ill, and my body actually wasn't on board with it. I'm not a body. Well, I am a body. I have a body. I am a body, and it should have been on board. I feel really angry.
Go with that. getting now?
I'm getting it saying, well, do you know what? You know, you're a contributory to this. So they say people who haven't had many infections tend to get cancer more because it's not firing up your immune system the same way. So perhaps my original injunction was a contributory factor.
Let's go with it.
And a contributory factor, not to blame, but a contributory factor. And you shouldn't have been drinking homogenised milk. Oh dear. Controlling parent should.
What are you noticing now?
What I'm noticing is that it's been a real good learning curve for me, although the experience was interesting. One of the chemos, the pain was excruciating, and what it did was it fired up all the places that I had the pain in as a child. So it's like my body was remembering it, and it was really fascinating for me. Also, what it did was I lost 2 stone in weight. And I started going to the gym, and slightly we do walking holidays, about 200 miles with a rucksack on our back, and I'm fitter now than I've been in a very, very long time.
Notice that. And see if there's a positive belief that represents all of this that you've been telling me.
Life is good. Live it to the full. And for God's sake, look after yourself better.
So, for God's sake, look after yourself better. Is there an I statement in that?
I should look after myself better.
How about I can? How does that feel?
I can,
Okay.
and I do, but not consistently.
Okay. Let's go
I
with
work
that.
too long hours.
Go with that.
So. I'm still angry with the bloody recessions.
Let's go with that piece.
I've got to take control of this. There's no point feeling helpless and upset and angry. I've just got to take control. So I've got to go back to the consultant. I'll send him an email. I'll have a word with him, and I'll see about where I can have this MRI scan done, and if I can have it done somewhere where the level of competence is a little bit higher.
And does that fit together with I can take care of myself?
Yes, it certainly does.
Let's move towards our wrap up by holding that solution together with that positive belief I can take care of myself.
Yeah.
And notice how that feels in the body. How you doing?
Okay, I'm thinking, will I be able to watch them putting the needle in? No.
Okay.
But, you know, that's okay, I won't look.
And that's a form of taking care of yourself,
Yeah.
I think.
Yeah.
Let's just wrap with that one. So I won't look. That is something I am in control of.
Yeah. God's sake, just get your act together, just have the bloody tests, make sure that they're negative and carry on with your bloody life.
Keep breathing with that.
And you don't need to take a baseball bat to somebody's head to make a point.
She said you don't need to take a baseball bat to somebody's head to make a point.
Oh, thank you so much. I feel so much calmer.
Let's take a couple of nice deep breaths to seal this in, whatever way feels right in the body. Is there anything else you feel we need for closure, for wrap up? Other than we'll probably get some questions, and it's up to you if you're willing to take some questions too. Because a lot of times people have questions of you as much as they do of me.
I'm interested how this is and I know this and I'm okay with this, but this is over 65 years of time.
Yeah? It's beautiful. Thank you.
It's amazing, 65 years of time. And it's still as real then. I can still, the sadness there, it's still as real then.
Yeah.
It's now, and I know this.
Yeah.
I know this.
Yeah. So how are you feeling overall about the work we did? And
I'm feeling very confident. It's very good. Thank you very much. It really will make a difference to me.